Welcome everyone. This is our second DTAC Pacific Regional Webinar Series. Thank you for joining us today. My name's Louisa and I'll be your host for today's session. For those of you who are new to our webinar series and have not heard about DTAC before, we are the Digital and Technical Assistance Centre, which was funded by NZ and now by NZMOH. And our goal here is to support our Pacific nations with digital health and supply chain solutions. So on that note, I'd like to take a moment to thank them for their ongoing support and for making this webinar series possible. I'd also like to give a big thank you to Kath as well, who's done a lot of hard work behind the scenes preparing today's webinar. Kath's also here with us to help answer any questions later on, so make sure you write them down as we go on. Now, today's session will be a bit different. Instead of a live presenter, we've brought together some of our mSupply experts from across the Pacific in a series of short pre-recorded videos, and they'll be sharing their favorite reports and even some dashboards and some open mSupply across the system and how they use these. So what we'll do is we'll play the video through, and if you have any questions, make sure you note them down or pop it in the chat. And at the end, we'll give you about 10 to 15 minutes and we'll have a chat about it all. So without further ado, let's get into it, and I'll hand the floor to Kath.
Hi everyone, I am Leo. I'm from Nauru Pharmacy Services. I am the Stock Control Coordinator. My favorite mSupply report is the purchase order report. The reason why I like this report, it filters the reports based on what information required. It also shows you the value of orders, PO numbers, quantities on order, and the quantities you have received, and also the outstanding quantities. I check this report on a weekly basis, sometimes fortnightly, and also before running our 6-monthly tender. After we review this report, it gives us the ordering option, whether we need to reorder, and also a follow-up with the suppliers. And it also gives us a financial values of the orders and the outstanding. So once you log into mSupply, you go to reports, and then you press the purchase order button here. And then it gives you these filtering options. You can put in the dates. We can also just press here, which shows you the other options. Let's just use previous month as an example. It also shows whether you want to include a specific item. You can also filter it here. But yeah, we'll just use this previous month report. So we press OK, it'll go to Excel. This is what the report looks like. It shows you the store name, PO number, supplier's name, the item descriptions, and also the dates. The dates, it'll show you when you place the order, and also the delivery date. This is very important. It shows you if you need to do a follow-up with the suppliers or place a new order because the supplier is running late, the lead times and all that. So this is where you will see the ordering packs, the pack size, the quantities you have received, and the outstanding quantities. And this side, you will see the financial value of the POs.
So I'm Jacob. I'm the project manager for the Kiribati supply chain reform. in Kiribati. I am a pharmacist by background, but a little bit lodgy, and been in Kiri now for 9 months. Been doing that. Bit of background about Kiribati. So Kiri, like other Pacific Island nations, is got all its main medical supply concentrated in one central hub, and then it has a spoke model where it goes to other separated islands or atolls, and there's sort of health centres on atolls with a couple of different bigger distribution points, being South Tarawa and Besso and Christmas. But one big problem that we all experience, I'm sure, is stockouts on those smaller health centres. And it's not necessarily clear how those stockouts are happening and why they're happening. So one thing that I really like is using the requisitions to sort of help identify or give inferences about what the underlying issue might be about those stockouts. We're sort of in the process now of deploying mSupply to these islands, and I guess it's like I used it a few times to see if deploying there will be useful. So it kind of helps with prioritizing that. Also, there's been a few stockouts that have happened over time. So I'd say like maybe reaching for it once every couple months, just for very specific things. We also had an outbreak for norovirus recently, and it was like a see if there is a bit of demand surge over stuff that is needed to deal with these outbreaks. So really good for detecting changes in demand. So I'm logged into the main store. And when we go to the reports tab, if we go down to the requisitions, and just to also note, this report is not entirely dissimilar to a transaction report. One thing I really like about the requisitions versus this, though, is that it's a little bit less finicky, because you just have so many options when you're going through transactions, and the requisitions as well breaks it up a bit easier into some different sections, which you're going to see in a little bit. Now, I'm just going to do it for this quarter, just because we send out to the outer islands health centres usually every 3 months-ish. So I kind of like to look at it through that lens. And because we're going to do we're going to use it to also generate an order fill rate. Then we also need to have the finalized section done. And we need to tick this box as well. Otherwise, that order fill rate is not going to be complete. And then you can do one thing that Kiri needs a bit of work around is the consumables. So you can select for medicines or consumables that way. But just for the instance of today, we're just going to leave it as is. I've already pre-generated this report, so I'll show it to you now. But when you click OK, it'll do the standard. If you want to pop it up in Excel, which is what I usually do anyway. So that'll be the next one there. I will show you the screen now. So after it's generated, you come up with something like this. You can see the Excel spreadsheet now, Kath?
Yes.
Sweet. So it's just got like, I've grouped this as well by the clinic, which you can't see because I've just redacted here, but it's by like the health center. You can also group by item. How it's good to go one way or the other is if you group by item, it's useful if there is, say, like an outbreak or there's a bit of a increase in consumption or demand for an item, or if there is a stock out, you can kind of see where the demand might be, or who might be running a little bit short. But I've got this grouped by health center. And then it goes with all the items from there. You'll see the status of the requisition, what the type it is, the date it happened, the stock on hand that the health center has, how much they've requested, how much has already been issued, and how much the central medical store has supplied. Now, this is really cool to me because from looking at this screen element, I can kind of identify, all right, is it a central procurement warehouse not getting enough medicines that's causing a stock out? Is it that the health center is not forecasting enough inventory, or is there a problem with logistics? And how you sort of infer that is, if there's a if you look at their stock on hand, and this is assuming that all the data is right, obviously, which for Curie is not always perfect, because mSupply is not currently in the outer island centers, but is in the process of. But anyway, this is typically from the distribution as well. But if they've got no stock on hand and they've requested a large amount, so let's look at, let's go here. So the amoxicillin, they've got no stock on hand. They've requested 2,000, and we've already issued 2,000. And there is, so we're not going to issue any extra quantity. What that suggests is that they are out of stock. And then you can go back and look at the requisition comment. Now, in Curie, we have a bit of a thing where it says if it's on time or late. Judging by the lack of on time, the descriptor of it being on time, this is late. So this might be, and you can probably infer from here that maybe they have forecasted not enough amoxicillin to get them through that period. So that's one sort of use. And like I said, you can also sort of identify logistics problems from there. So if the central medical store is supplying none because there's already a quantity issued, where is that? Where is those 2,000 amoxicillin tablets? Like, where are they? And maybe that might be that it's still sitting at a when to be shipped. It hasn't been put into the system from the health center side. Gives you a bit of a picture to explore from there. And then we can look at like a, says another good one. This is good. So amlodipine. So they have 500 on stock. They've requested 5,000. We've already issued 3,000, and we're just going to supply the extra 2,000. I look at that and I'm like, okay, cool. Like the forecasting for amlodipine consumption for that health center is probably appropriate because they have enough to cover what will likely be the lead time to get the stuff there. And they've got some en route as is. Maybe just a little bit of tidying up with how much they need so they can have one bulk order. But we have a bit of a, we're still in the process of working out those more streamlined, not using emergency requisitions yet. So that's sort of like the bare bonesy bit of that. If, for example, there is like a perfect fill rate, an imperfect fill rate, which we can get by looking at how much is supplied divided by their stock on hand. What that gives is like maybe we're only giving them 90% of their order that they've requested, which might be suggestive that the central medical store is either not procuring enough, and so they are rationing stock. That might be a budget issue. That might be That might be another logistics issue. So you can kind of see where the etiology of the stock problem is coming.
Hello everyone, my name is Santoria. I am from Samoa and I am a health supply chain project officer working for BES. My favorite ones are the out of stock and low stock dashboard pages or reports. So these reports are very useful because they quickly show which items are either unavailable or are starting to run low. So, and it also gives us time to act before facilities completely run out of stock. Would check these reports at least once a week, sometimes almost daily if stock movement is fast or if there are urgent supply issues. See, it's important to check these regularly because it helps identify problems early and we can make necessary plans to avoid complete stock out by arranging new supplies early, avoiding interruptions, and help make sure patients continue receiving the medicines they need without delays. Items appear on the low stock and out of stock reports. I would follow up on pending orders, follow up with suppliers if stock can be delivered immediately, alert the relevant team so action can be taken before the item runs out completely by escalating urgent procurement or redistribution of stock from other facilities with enough supply to spare. And I would also investigate the reason for the shortage. So these reports are also shared with clinicians and pharmacy dispensaries so they can put temporary stock control measures in place, such as managing usage carefully or prioritizing urgent cases until supplies are fully available again. So overall, these reports support better planning, reduce the risk of stockouts, and help ensure health facilities continue receiving medicines and supplies without interruption. So the usual login to dashboard, and for the purpose of this illustration, just to like to highlight that this is just a demo file, so none of the information here are true. So these are all made up just for the purpose of this illustration. So I would go to the 4 square icon and you would see a list of folders. And usually for some countries, they would have it under stock availability or stock reports. And then you can see here, there's the stock availability folder. And if you click on that, if you click on the stock availability folder, it will bring up the page. And then this page has got like quite a few panels. And the 2 panels that I would like to focus on is the out of stock panel and the low stock panel. So before I go into those reports, I'd like to just highlight the filters. These are also very important. So these are the general filters up here. So it can filter out the specific information that you want to look at. So for example, we can filter out, say we want to look at just the information and data from Auckland Pharmaceutical Warehouse. So I will click on that. And you can see it automatically filters out just to bring up the information just for that particular store. So, and there are also other filters here, like the item category 1, item category 2. So this one I would also use because say I would just want to look at medicines, for example. So I would filter out the consumables and just, provide me just with the list of medicines. And there's also items here. So I would usually click all just to bring up all the medicines. There's also the critical stock filter. You can choose to have a look at the stock that are only listed in your critical items list or not. And this is another important filter that I often use is the if the medicines that I'm wanting to look at is on the essential medicines list. So say I'm only wanting to look at the meds on the essential medicines list, I will click or choose true. So you can see already some of the items have been removed. There's also the AMC look back period. So if you want to look at, I don't know, the AMC for the past 3 months, past 6 months, but usually for this case, we would choose to bring up that AMC for the past 12 months. There's also another important filter at the top here. It's a time frame filter that you can choose to look at. You can choose to look at results or data from the last 7 days or the last month, even last 3 months. But, if you're working in a facility with good data, usually we would go just to look back period of last year or even last 2 years. So that could bring some good data for you to look at. So after you've applied all your filters, you would automatically see that in the panels below, like you have, as I said, we only wanted the store, like the Auckland Pharmaceutical Warehouse store, so it's only captured there. And you have the list of items. So these are only items that are on the medicines list, which are currently out of stock at the Auckland Pharmaceutical Warehouse. So going through the other panels, the other columns, you have the unit column, the AMC column, and here's another important column that I often also look at is the PO placed. So again, being mindful that this is the out of stock list. So you would want to check if an item, like there's an expected order for that item. So you see there are also a few blanks there. So that means there's no order currently being placed. So you're not expecting an order for this item. So it really makes you think or prompts you to act. Okay, do I need to place an emergency order for this stock, or look into why there's no order currently placed? You can sort this column by just clicking on the blue labels, and it will you can see an arrow there, so it can sort from lowest to highest or the dates that was placed, or you can also use the funnel to filter it in. So you can say I'm only wanting to look at items with no orders, so I can just click on blank, and that should bring up all the items with no orders currently in place. And again, we can go and click clear filter so that all the information brings back up again. So we can look at this. And you also have the column that contains the quantity of the orders in place and the estimated delivery date. So these are useful for your follow-ups with suppliers, or you can request for immediate delivery if it's emergency that you really need to have stock on hand. And there's also, this is another important column. So as I said before, this is a demo file, so it doesn't have the numbers here, but if you would refer to your live dashboard, you would have some numbers there indicating the number of days that that particular item has been out of stock. So it also makes you want to look at, okay, why is this item out of stock for so long, like a few days or a month or even up to a year? And that can determine some factors or make you think whether we need to, for example, if it's an item on the essential medicines list, whether we need to consider if it could be removed, maybe it's got some issues, or just to have discussions with clinicians if looking at alternative because we're finding it really hard to source this particular item. Coming down to the low stock panel or the low stock report, very similar columns, but instead of the number of days that an item has been out of stock, because we still have some stock, it's just that it's low, we've got the months of stock remaining column. So this gives you an idea of the quantity or the number that you have in terms of the months. And again, you can also sort. You just click on it and it will sort, giving you the list of items with, less than a month up to, if we scroll down, it goes to up to 5 months. So again, it prompts you to act immediately. Okay, we have low stock and we need to place some emergency orders or look at other facilities if we can redistribute from other facilities so that stock is shared. So that's on dashboard, but again, you can also extract these reports onto an Excel file that you can, manipulate and simplify, and that information is shared with clinicians or pharmacies so that they can make their necessary preparations on stock management. So yes, that's it. Thank you.
I'm Cecilia Le'atoa from Tonga. I'm the stock control officer for pharmacy department here in Tonga. My basic role is to overlook incoming of new codes and even outgoing, and even take closer looks to the stock, if it's low or overstock or even out of stock. But there are different reports that runs while doing all these roles, including expiry reports, new goods received reports, dashboard report monthly, and outgoing reports as well, that are all handed to the principal pharmacist. Very mSupply report is expiry report, which this report includes all the main highlights, the value of expired goods that will be going to waste, and also from this report, I also abstract from the mSupply items that will be expired for the next 3 months. So warehouse team and even the principal pharmacist can take a look and take actions for to minimize all the costs that will be lost. Expiry reports I usually does this on every end of the month, which is can be well, I'm gonna pull out this report and then inventory adjust it so we can see the total value that are expired and all the items that are expired, but together with the 3 months, I also does it on the end of the month. So to produce this report in mSupply, you'll click on expiring items, and then if it's today, it's the end of the month, I'll just leave it as it is. Or you want me to demonstrate the 3 months? Oh yeah. If it's 3 months, and then click on that, and then go to next 3 months, and go to department, because in here in Tonga we have 2 different departments. Click on medicines, and then I can even go further into master list depending on which site that I will need to be based on, and then go to liquid and external room, and then okay. Export to Excel. In this report, as you all can see, that these are total items that will be expired in the next 3 months for ASEA in Tonga in just the liquid and external room. So it also has the value for each total quantity and pack size that would be expired. And as you can all see, it includes all the total amount of all these expired goods.
My name is Kavya. I am a project manager with Beyond Essential Systems, and I've been working on a few open mSupply projects in the last few years with them. My favorite open mSupply report, which is the open source version of mSupply, is called the stock status report. The reason I like it is mostly because it's like a very clear indicator of where you are in terms of your inventory supply chain system. And then it's a good starting point to see what you need to do next. Do I need to check my expiry? Do I need to go to suppliers? Do I need to go to customers? And most importantly, it has some colors in it. For the countries I work with, I recommend once a week. So you can bring everybody together and kind of do a review. But from an inventory manager perspective, at least every 2 weeks. The result tells you whether you're overstocked, understocked, well-stocked, or you have no stock. So the action depends completely on where we are. So if you're overstocked, either go to expiry and see whether these things are expiring, or go to your customers or other countries and probably share it with them. If you're understocked or out of stock, check in with your suppliers, check in with your procurement team. Maybe you need to order them. Maybe we need some distribution rationalizing activity, or you need to tell your customers to be aware that there is a low stock of these items so they can also do better distribution from their level. Okay, so this is how an open supply screen looks like for those who are unfamiliar with it. The way to get to the reports is down here, this section called reports. There are multiple reports based on the categories, and I'm going straight to the one I like, which is the stock status report. Now it has a bunch of filters through which you can look at the most important reports that you want to have a look at. Firstly, you can customize it by item name, item code, but also you can see how many months in the past you want to have your consumption calculated by. You can also see adjust what your minimum or maximum months of stock is. So in this case, for example, something between 3 and 6 is well stocked. Something above 6 is usually overstocked. Something above 3 months is low stock. So in this case, I'm just not going to change anything and just go ahead. So this is what the report looks like. You can click on a little list to expand your screen. Firstly, there is a bit of a guidance on how to read this report. It explains some of these columns in a bit more detail. Firstly, there is the code of the item, name of the item, and this colorful section of what is your current stock status for this. Is it overstocked? Or in this case, this is well stocked. This one's understocked, and the last one's out of stock. And the way to read this, how to come up with this specific status is by looking at your consumption. For example, in this case, I've said, look at consumption of the last 12 months. So as per that, the specific for the first item was like about 64 bottles of it has been used in the last 12 months. AMC is average monthly consumption. So you've used about 5 bottles every month. Your current stock on hand, that's what SOH stands for, is 244. And which means the months of stock. So this 244 bottles will last you 45 months, which is a lot of time. And especially for the store, which says more than 6. So as a result, this is considered an overstock. Similarly, if you just go by each one, so the well-stocked one is 3.2 months, which is just between the 3 to 6 months defined. Then we have the understocked ones, for example, albendazole tablet. So it's 0.7, which is just below that 3 month, less than 1 month actually. So definitely requires action. And the last one says out of stock. So you consume about 65 in the year and you have none of it in stock. And what you can do with this report is you can either print it. So ideally when you print it, you can see the screen pretty much exactly the same way what you see when you open the report. It can be further customized with some headers. So once you save it, it becomes a PDF. There's also an option to export this file into an Excel. So if you click on export, this takes you straight into the status to download the Excel version. I can also show you that. All right. Hope the report's now visible. So in the Excel file, it basically shows you the exact same details, maybe without the fancy colors. What I would ideally do is maybe just put a filter, go to data and filter, and look for everything that is out of stock and under stock. And then maybe discuss this with your procurement team and check if you have orders ready or need to be placed. For things that are overstock, maybe go ahead and check if these are within date, check your expiry report, and maybe make the distribution decisions with your other stores. And for items that have no consumption, is basically means that nobody's used it in the last 12 months. Maybe are these expiring? Should you distribute it to somebody else? Do we not need them in the future? So these are decisions you can take as well with the same report.
My name's James Neeson. I work with Beyond Essential Systems as a project manager in Fiji, and I was also working in Kiribati. I'm a bit of a report fiend. I love them. There's quite a number that I do enjoy, but probably my favorite is the each invoice line by item. It's a transaction report, and it shows you how each item is moving. So whether it be to the facilities, into the central stores, or through inventory adjustments. This report must, especially if you're doing it for your customers, can be checked weekly, even daily if you'd like, depending on how frequently you are doing your distributions. Typically, I would say at least weekly to check this one. As a result of checking this report, there's several actions that you can take. One is you can review how your items are moving, so you can see if there's a pattern as to how they're moving throughout the months. And what that can tell you is that if there's standardized consumption, or if there's been a spike in consumption, or if we can see low consumption, which might tell us that we are rationing stock. If we see a spike in consumption, especially if it's quite a dramatic spike, that might be for several reasons, and then that would cause an investigation, so you can look into why that has happened. Another good thing it does, it shows you how many invoices a facility is receiving in a given period. And then you can see if they're a bit of a problem child, or maybe if they have neglected to send in their order, which then gives the central stores a bit more strength than to say, hang on, these facilities aren't sending their orders, and we can start focusing on them. I'm currently just using my offline training mSupply. Because I started in Kiribati, this one is, it does show that it is in Kiribati, but all this data is anonymous. So we go to reports, then to transactions, okay, and then it's each invoice line by item. So it's the third one down. And as I alluded to earlier on, there are several different types of transactions you can check on this report. So if I drop down this menu here, I can see sales to customers. So these are our customer invoices, so everything we are distributing. This is our purchases from suppliers. So when we create a supplier invoice, this will show us all the transactions against the supplier. So it's not the purchase order, but it's when we've done our goods receipt and then received it in. And then we can also see any inventory adjustments that might be happening. A good one I do like to do is all, so you can see, you can get a really good clear picture as to how much is coming in and how much is getting sort of adjusted on the system and how much is going out, because ideally what you want to see, what is coming in is what is going out. Today I'll keep it simple and we'll just focus on sales to customers. You can further filter this over here in the item filter. So if you just have one particular item you want to focus on, or if there's a category that you wish to focus on as well, you can obviously select those. I will change the date range to the date range that I had on my report. So what I like to do is I'll go previous year. Is it previous year? But I'll just change this to March. Okay, so I just want 3 months, because this report is quite big. If you do it for 1 year, it will take some time to generate. Okay, let me go OK, and it it's come up like that just because this is an offline version, but this is how the report will look. Okay, so what we have here, we have our item. This is our customer here in this to from column. Okay, here is the code that will normally be filled out, but because I've anonymized everything, that's no longer there. This is the date of the transaction. This is the invoice number. This is the number of packs, the pack size. This is a really important one as well, because for an item, what you'd hope to see is just a standard pack going out. But as we can see here, it's been changed to 1. Okay, and the quantity is 2,250. So depending on the customer, that might be a bit of a red flag and something to investigate. And here's your total quantity. So this is the number of pieces that have gone out, okay, the batch number of the item, the expiry date, and the cost of it. Now, as this report is, we do need to do a little bit of data manipulation or Excel manipulation to make it readable in a pivot table, because our end goal is we want to see how our items are moving from month to month. So what I'm going to do, I've already added a filter, okay, and to do that, I just highlighted row 3, went here, and then selected filter. Okay. Now the first thing I want to do is to delete the totals, because what the totals do is they calculate all of this as a sum. But when we put it into the pivot table, that data is going to duplicate. So we don't want any duplicated data. So I just want to get rid of those totals. So I'll filter, select my totals. Okay. Now just highlight this entire column, right click, and then delete these rows. So you can't delete the text, you actually need to delete the rows. And this might take some time as well. So as you can see, the report is thinking, okay, it's done. Now I unfilter. Okay. The next thing I need to do is, in order for the pivot table to work, each cell needs to be filled. Now at the moment, we can see that these are empty. So I want to fill those. So what I'm going to do is go down to the bottom of my to from column, and then just go to the right, to the left, just so that I've highlighted all these blanks. Now to fill those in, I come up to find and select, go to special, blanks, okay, equals, select the top cell, and then press Control and Enter together, and that fills in our blank cells. Now this data will be usable for our pivot tables. The next thing I want to do is I want to have a month for these dates here, because in the pivot table, I want to break it down from month to month just to see how the item is moving. So in order to do that, I do this formula. So equals text, open bracket, select the value. So the value in this case is the date, a comma, and it's asking for our text format. So this, I want it to say January for the top one, and then I want it to say March for the next one, January again for the next one. So I need to do quotation marks, 4 M's, close quotation marks, close bracket. Now I've got January, and then I just auto-populate that. Okay, just do a sanity check to make sure all the cells are filled in my month column, and they are. Okay, so this data is 3 months as we selected. It's from the 1st of January to the 31st of March. Now to put it into a pivot table, just select the cell A3, go to insert in your ribbon, pivot table. Now always select this one here, add this data to data model, and go OK. Okay. So now we have our pivot table. And as I mentioned with this report, you can see how your items are moving over a given period of time. So if I take my items and put them here, and then I take month and put that into columns, okay, I'll just sort that from highest to lowest. Now I can see January, February, March grand total. I just want to do a fact check, sanity check to see if there are similar quantities going out each month. Okay, so I've got total quantity. And what I can see, so for this particular item, 4 went out 22, then 10. What I like to do is just sort it from highest to lowest. So to do that, we need to go into the pivot table itself. You can't go up in the top headings there. It needs to be in the pivot table. Go up to your right-hand side, go sort largest to smallest. Okay, and I can see that Our usual suspects are up there. Paracetamol, aspirin, Nelapril, of course. But this is a bit of a weird one. Okay, stool container. January, we've got 120 million that went out. February is the same, but in March it's 4,350. Okay, so that is quite a red flag, right? So if I double click on that there, that's going to open up every single transaction against just that stool container. And what I want to see is the total quantity. So I'm going to again sort from largest to smallest. I can see straight away that it's these two invoices here that that have the issue. Okay, so again, to Topcat Health Centre, they received 120 million, and so did Elroy Jetson Health Centre. Okay, now looking at this, what I can see here is column I, pack size, has been changed to 2.4 million. Okay, now that's obviously incorrect. And if I jump to column K for the batch number, I can see that somebody has changed the pack size to be the batch number. And the error that this has given me now is that we have distributed 240 million stool containers to two facilities, whereas in reality, it's actually just 50. Okay, so it should be 50 by 1. And these two facilities as well, they could be big facilities, they could be small facilities, but mSupply is considering this as true consumption. So if we do our suggested order quantity report, it's going to consider this fact, and then it's going to tell us that we need to order this amount. Now, in order to rectify this, now that I found it, we would get Topcat Health Centre and Elroy Jetson to do customer credit. And then when we receive that customer credit in, we would just have to write that stock off our system. And in this case, it hasn't been added. So our cost price hasn't been assigned to these items. So that also tells me straight away that these were added through an inventory adjustment or a stock take. So it's a good chance for us to then take good care, and a training lesson for us to be careful when we are doing those things. Now, in order to investigate it further, I can see that the invoice number is 30088. So I could jump onto mSupply, check that, and then do a further investigation. That's why I like this report, for seeing the patterns of the consumption for our items. Okay, another really good way that this report is useful is by just seeing how many invoices a particular facility is receiving in a given period. So again, we've got 3 months here. I've just put to from. So to from is actually our customers. Now, if we were looking at purchases from suppliers, that would be our supplier invoices. But in this case, it's our facilities. And I want to see how many invoices have gone out to each facility per month. Okay, so I grab invoice and pop that down here. Now, at the moment in the values, it's summing the invoice. So what it's doing is adding each invoice number. I don't want it to do that. I want it to just count the invoice numbers. Okay, so now what it's doing is counting the invoice numbers. And what this is telling us is how many lines have gone to that facility. Okay, so if I jump back to our original data, okay, these are the invoice numbers. And because it's done by item, this particular invoice number can appear several times, depending on how many items were distributed on that invoice number. So at the moment, what this is telling me is that 28 lines went to Apuna Husapin Pedalon Health Centre in January. If I want to see how many invoices went there, okay, I jump back here and do distinct count. Okay, select. Okay, so of those 24 in January, it's from 3 invoices. Okay, and if I want to see who my most frequent flyer is, again, I filter it from highest to lowest, and I can see that Chief Wickham Health Centre in 3 months received 124 invoices. Okay, Judy Jetson received 98. So what I'll be looking to see is that if there's a pattern. Now, if we jump down to Popeye Medical Centre, we can see it went from 3 in January, 19 in February, and then 0 in March. So for me, that's a bit of a red flag. I'd check into that health centre, see how they're going. I'd speak to sort of who the managers of those health centres are, make them aware this is what's happening, because it gives the central medical stores a bit of strength and to push back on facilities when they say, oh, look, we've been doing our ordering, but we haven't been receiving, this is a source of truth. Yeah, and this is why I really enjoy this report.
Everyone. My name is Alex. I work for the Fiji Pharmaceutical and Biomedical Services under the Ministry of Health in Fiji. I work under the Goods Monitoring Department, and my main job is to actually watch and check how medical supplies are managed across health facilities and try to make sure that the mSupply system is working well and that the information in it is correct and up to date. My favorite mSupply report is actually the stock status report, which I access through the dashboard under the stock management folder, and it's specifically within the stock availability. I find this report particularly useful because it gives a clear and a comprehensive overview of our current stock levels across items. It helps me quickly identify stock on hand, potential stockouts, and even overstock situations. So this visibility is very critical for us here in Fiji in maintaining a very reliable supply of medicines and medical supplies. And it supports our senior managers in effective decision making in our day-to-day operations. For the stock status report is that I review and run the stock status report on a monthly basis. I use the results as part of my regular monitoring activities and will present the findings to the senior managers every month during my stock analysis presentation. And in this presentation is that I have all the senior managers, all the program managers, warehouse supervisors, and we try to ensure that the management stays informed about the stock performance, looking at some of the risk, and if there are any areas that require attention and improvement. So for my stock status report, I'm able to access the report through the stock management, stock availability in the dashboard. So through the months of stock report, I'm able to get more detail of stock availability of all the items here at FPBS. And from that report to the dashboard, I'm able to export an Excel report where it's with much more detailed information that I actually share with the senior managers here at FPBS. Yeah.
All right. Thank you to all our presenters today for the amazing insights you guys have shared. It was great to hear about all the reports that you guys are all using and what it all means for you guys. So now let's open the floor up for discussions. I can see that there's been no questions or anything posted in the chat. So does anyone have any questions? And in the meantime, if you guys are still thinking about your questions, I just want to pass the mic over to Tutai from Cook Islands. I believe she wants to share as well what her favorite mSupply report is. Tutai, are you still there?
Kia ora, everybody. My name is Titai Iwaoke. I'm a pharmacy technician with the Cook Islands Ministry of Health. I think thank you to everybody for their presentation on their favorite reports. Like some of the presenters, they're all great reports to help ourselves, help our facilities in ensuring that we don't run out of stock on items. I also like the expiry report. It help us understand what medications that we have that are expiring within the next month or 3 months. So that also helps us to decide where to move stocks. Like for example, here at the primary healthcare center, we use a lot of antibiotics more compared to the hospital. So let's say, for example, Amoxil 250 capsules, we don't quite use them a lot. But if we do see that we have a lot of stock of Amoxil 250, we will try use that within the 3 months expiry date or the month expiry date by doubling the dose. So rather than dispensing a 500, we'll be using the 250 so it doesn't go to waste. And then we can shift stocks from the hospital to primary healthcare or from the outer islands back to the main island, Rarotonga, so that stocks can be used. And also one of our favorite report is the transaction, especially for totals for each item and totals for each name. That gives us a fair idea of so we retrieve that report weekly. It gives us a fair idea on how many items we have dispensed over the week, as well how many patients we've seen over the week. So those reports are given to our health information unit, and that is distributed to all our Ministry of Health users, so they can see a pattern, or they can see not only in the pharmacy but areas like lab, in the main hospitals, so they can see how many items have been dispensed, how many patients have been seen over the week, and it also includes the most popular items for the week as well. Thank you.
Thank you so much, Chitai. It looks like you guys really make good use of the reports. Are there any other questions or any other things that you guys want to share? Okay, I have something for Kath then. Hi, Kath. So I was just wondering, during your interviewing, was there anything that was shared that didn't end up making it into the interviews, or otherwise, what was your favorite report?
Oh, great question, Louisa. I think my favorite report, I really liked, and I'm not sure that we got all of it captured in the interview, but James was explaining how he manipulates the Excel file once he's downloaded the report. And I know, mSupply has over 30 preloaded automated reports. But you can also extract so much, either from the dashboard or in Open mSupply by using the export function, or in mSupply Legacy as well by using the reporting features and exporting to Excel. And once you have your data in Excel, if you've got good Excel skills, you can do lots of data manipulation to find pretty much any of the information that you need. And I know that in the mSupply Foundation, in our online training modules, we have a whole section on how to do Excel manipulation. So if you're a little bit rusty in using Excel, I really encourage people to do that, because I think sometimes people are looking for data and they might not find exactly what they want in mSupply. But when you combine that with some good Excel skills and good Excel manipulation, then you can pretty much find anything that you need.
Oh, thanks for that, Kath. That's amazing. I'm just going to read what Asaili just said. During the interview, what are some of the most common challenges that countries shared in ensuring good data and reflected in the mSupply for effective reporting? Kath, were there any common challenges that were shared?
Yes, certainly. I think the most common challenge is, and you did see a little bit in the interviews, but making sure that the data we have in mSupply to begin with is correct. So making sure that things like goods receipts are done on the same day that the goods arrive in country, are processed in mSupply, because then we can calculate our lead time. And likewise, things like double checking and making sure that our customer invoices are processed on time on the day processed in mSupply on the day that we distribute it out to outer islands or other health facilities or hospital departments or wards, to make sure that we have all that data captured in mSupply really accurately. Updating purchase orders and the estimated delivery dates for deliveries in the purchase orders is another one. It's really important that All those intricate details are updated in mSupply so that our reports are accurate and we're making decisions based on accurate information and data. I think that's the biggest challenge for everyone because it often involves lots of different people and lots of different departments, but everything they do in mSupply that enables us to use the reports.
Cool, thanks for that. Yeah, I do know that some of our countries face that challenge quite a bit. It's now been an hour. Is there any last minute questions? We can take one more. I'll give you guys 3 seconds. If not, we're going to close off for the day. Okay, so that brings us to the end of the second webinar of our webinar series. Our next one will be looking at about 4 months from now, and as usual, we'll send an email out when it's coming up. Today's recording will be available on both the mSupply and BEF YouTube channels, and it will also be available on our e-learning platform at learn.msupply.foundation. So make sure you guys register if you haven't yet. There's a lot of great courses and content on there, and like Kath said, our introduction to mSupply reports is also on there, which is a nice segue from today. So again, everyone, thank you all for coming and hope you guys have a wonderful rest of your day. See you guys next time.
Bye, everyone.
Thank you.
Bye.